you said we are probably headed for a 3-digit rise. I don't think that's what we are saying, right? We don't know. The answer is we really don't know. We are trying our best not to have that scenario. We are trying our best to manage the number of new cases every day. But the point we are trying to convey is it's important to go beyond the headline number. You need to understand what is in that number of new cases. If the vast majority of our new cases continue to be people returning Singaporeans, right, or from overseas, or residents living, working, studying overseas, they come back, we are going to isolate them for 14 days, and then they report symptoms. I would be less alarmed because we can deal with that problem. And we want to treat all Singaporeans who are returning too. So we can deal with that. We will have the capacity to deal with that. And so if the numbers rise largely for that reason, we shouldn't be overly alarmed, right? And in fact, it's for good reason that our Singaporeans are coming back and we are treating them and giving them the best care. If the numbers rise for a different reason, which is that we are seeing local transmission, we are seeing infections, new infection clusters that we might not have detected before, and then it's starting to spread within our own community. That's a different reason. That's a bigger reason for alarm, because that suggests that despite our best efforts at the borders, despite our best efforts at contact tracing and stamping out infection clusters, we still have not been able to detect completely all of these different cases popping up. And it would then suggest that the virus is transmitting in a sort of a self-sustaining way within our own community. Now that would be reason for alarm, and that would cause us, I think, to take a lot more stringent measures than what we are today. Right? So again, we've got to go beyond just headline numbers, understand why the numbers are going up, who are these cases, where are they coming from, and then take the appropriate measures. That's why today's measures focus very much on travel restrictions, because we are seeing a lot more of these returnees carrying the virus, but we have not picked up a lot of community spread or a lot of community transmission of the virus within our own community yet. You all know that we do background surveillance, we do background testing. Anyone with respiratory symptoms going to clinics, we do a surveillance and we pick up samples to do testing. We have not picked up from these tests evidence that there is widespread community transmission of the virus. So that's the situation we are in. It's largely still coming from imported cases. It doesn't mean that we can relax within our own community, right? So we have to do all of the strategies in parallel. Stay tight on our borders, continue to be vigilant with contact tracing, and continue with efforts on social distancing, which we will announce more details shortly. So work in parallel, but do it in a calibrated and progressive fashion, and always based on data and evidence.